Welcome to the Deep Dive. We're your shortcut to getting really up to speed on important topics. And today, we're jumping into something that definitely worries a lot of us pet parents.
Ticks.
And, the nasty diseases they can spread. Our goal here is simple. Give you the crucial, practical info, maybe even some surprising facts, all pulled from solid veterinary research. Basically, everything you need to protect your dog.
Exactly. And we're going to walk you through it all. We'll start with the basics, what these little parasites actually are. Then we'll get right into the practical stuff, prevention, spotting the signs if your dog does get sick. And we'll even touch on some pretty interesting new research towards the end. We want to connect those dots for you so you can turn that worry into, confident action.
Right. Think of this as your essential briefing. We've sifted through a lot of information to pull out the really key stuff. So let's dive in. First off, what exactly are ticks? And why are they suddenly such a big deal?
Okay, so fundamentally, ticks are tiny, eight-legged parasites. Technically arachnids like spiders, you find them pretty much worldwide. And their whole deal is they latch onto your dog's skin, in this case feed on blood, and that's where the danger comes in because they can transmit some really serious diseases while they're feeding. Oh, and a really key thing, their saliva has this substance that makes the bite painless, so your dog probably won't even feel it happening. Super stealthy.
Wow, painless. Okay, that definitely makes them sneakier.
Hey.
You also said they're a growing concern. Why now? Are there just more of them?
It's definitely a changing picture, yeah. We are seeing tick populations booming in many areas, and they're spreading geographically, too. Things like, climate change, warmer winters, changes in land use. They're pushing ticks into places they weren't common before. Plus, their active seasons are getting longer. Some are active almost year-round now, even in colder months. And all that just means more risk for our dogs encountering them and getting those diseases. And, even without disease, a really heavy infestation can cause problems like anemia or just bad skin irritation.
Okay, so they're stealthy, they're spreading, but it's not like every tick is the same threat, right? You hear different names thrown around.
Exactly right. Different species carry different diseases. It's all about what pathogens they pick up from animals they feed on earlier. An infected tick passes those germs, usually bacteria, through its saliva when it feeds. But, importantly, it usually takes some time. How long depends on the disease. Sometimes just a few hours, sometimes takes a day or two of attachment. Knowing the main types helps understand the specific risks. In North America, there are maybe 4 main ones to really keep an eye on for dogs. First, there's the deer tick, or black-legged tick, mainly eastern U.S. and Canada. This is the one infamous for spreading Lyme disease. That's a huge concern. But it can also transmit anaplasma and ehrlichia. And these guys, they can be active pretty much year-round in some spots. Peaks in spring and fall.
Lyme disease. Yeah, everyone knows that name. Okay, who else is on the list?
Then you've got the Lone Star tick, common in the east and southeast U.S. The females have that obvious white spot on their back. These guys transmit stuff like ehrlichia and also a type of rickettsiosis. And quick note for cat owners listening, this is the tick that transmits cytozoonosis, which is often fatal in cats.
Good to know. Okay, number 3.
The brown dog tick. This one's kind of unique. It's found all across the U.S., pretty much everywhere, and its trick is it can live its entire life cycle indoors. So it can infest your house, kennels, makes it really tough to get rid of. It carries things like babesiosis and ehrlichia, too.
Indoors. That sounds like a nightmare. Okay, and the last one.
The Asian longhorned tick. This is a relative newcomer, first spotted in the U.S. around 2017, but it's spreading fast. We're still learning about it, but lab studies show it can transmit Rocky Mountain spotted fever. What's really worrying about this one is parthenogenesis. The females can lay thousands of eggs without even mating.
Oh, wow. They can just clone themselves.
Basically, yeah. Leads to huge population explosions really quickly.
Okay, that's quite a rogues gallery.
Yeah.
So with these sneaky, painless biters out there, how do we, as owners, actually know if our dog's been bitten or worse, is getting sick from a bite? I guess the symptoms aren't immediate.
That's exactly right. Because of that numbing saliva, you probably won't see any reaction right away. You might only notice a tick infestation itself if, say, one gets in an ear and causes head shaking, or maybe if it's between the toes and they start licking or chewing at their foot, that kind of thing. But the really serious signs, those come later from the actual diseases. Could be days, could be weeks after the bite.
Okay, so what are those signs we need to be vigilant for?
Well, one really alarming sign or set of signs relates to bleeding issues. You might see these tiny reddish purple spots, almost like pinpoint bruises under the skin or on the gums. They're called petechiae, or even things like nosebleeds. If you see that, it could point to serious diseases like Ehrlichia or anaplasma. Check areas with less fur, like the belly or inside the ear flaps. They're easier to spot there.
Petechiae.
Yeah.
Okay, tiny bruises. Got it. What else?
Beyond that, a lot of these tick-borne illnesses share some common sort of general symptoms. It can be tricky. But the big ones to watch for are things like sudden lameness or maybe stiffness that seems to shift from one leg to another. That's pretty classic for Lyme disease.
Lifting leg lameness. Okay.
Yeah. Also, swollen or obviously painful joints, a fever that just won't quit, loss of appetite, maybe some weight loss you can't explain, just general tiredness, lethargy. Your dog just seems really off,
Right.
low energy. You might also notice their gums look pale or other unusual bruising. Sometimes in large lymph nodes, you might feel lumps, say, under the jaw or behind the knees, or maybe swelling in the legs or face. And less common, but definitely serious, are neurological signs. Things like seizures, or they seem unsteady on their feet, kind of wobbly.
That is a lot to look out for. And you mentioned neurological signs. That brings up tick paralysis. That sounds different and really scary.
It is different, and yes, it's very alarming. Tick paralysis isn't actually an infection. It's caused by a neurotoxin that certain ticks release in their saliva while they're feeding. Symptoms usually kick in after a tick has been attached and feeding for, say, at least 5 days. And it typically starts as weakness in the back legs that rapidly gets worse. It moves up the body and can lead to complete paralysis of all 4 legs, sometimes within just 24 to 48 hours.
That fast. Wow.
Yeah, it's quick. Other signs can include weird stuff like they can't blink properly, their jaw seems weak, maybe their bark sounds different, or they have trouble swallowing. And the really critical danger is if that toxin affects the muscles used for breathing. That can lead to respiratory failure, which can obviously be fatal.
That is incredibly serious.
Yeah.
Okay, the message here seems crystal clear. If your dog shows more than one of these signs, especially if you know they could have been exposed to ticks, call your vet immediately. Right. Don't wait.
Absolutely. Prompt diagnosis and treatment are key.
Okay, let's shift gears then. This is all quite concerning, but let's talk about what we can do. The proactive stuff. Prevention. What's the best game plan to shield our dogs from all this?
Great. This is where we can really make a difference. And the single most important thing, consistent year-round tick prevention. Like we said, ticks aren't just a summer problem anymore in many places. You need that protection all year long.
Okay, year-round. Makes sense. So what does that look like? Pills, collars, those spot-on things.
The most reliable foundation is definitely routine tick medications. And yeah, they basically come in 3 main forms. Oral medications, those chewable tablets. Dogs usually take them like a treat. They get absorbed, protect the whole body from the inside out. Big plus, bathing or swimming doesn't affect them. They work by messing with the tick's nervous system or ability to feed.
Okay, chews sound convenient. What else?
Then you have topical solutions. The liquids you squeeze onto the skin, usually between the shoulder blades. Good option if your dog's a picky eater, maybe. But you do need to be careful. Keep kids and other pets away until it's totally dry. And getting your dog wet right after application can sometimes reduce how well they work.
Right. And collars.
Yep, collars are the third main option. Some provide really long-term protection, like up to 8 months. They slowly release the active ingredients over the dog's skin and coat.
Okay, but the shelves are full of different brands. It's kind of overwhelming. Can you give us a few examples and maybe highlight any really important warnings we need to be aware of when we talk to our vet?
Absolutely. It's crucial to have that vet conversation because they know your dog's specifics. One important thing you'll likely discuss is a class of drugs called isoxazolines. They're very common now and very effective. Think brand names like Bravecto, Simparica Trio, NexGard, Credelio. They work really well against ticks and fleas. However, and this is important for dogs that have a history of seizures or other neurological issues, vets might be cautious. These drugs can sometimes lower the seizure threshold. It's a known, though uncommon, side effect.
Okay, good to know. Isoxazolines.
Yeah.
Ask the vet if there's a seizure history.
Exactly. Bravecto offers long protection, up to 12 weeks for many ticks. Simparica Trio is great because it also covers heartworm and some intestinal worms in 1 monthly chew. NexGard and Credelio are also popular monthly chews. If you're thinking collar, the Seresto collar is a big one, lasts up to 8 months.
Right. What about the topicals? Any specific warnings there?
Yes. This is critical, especially if you also have cats. Many effective topical treatments for dogs contain permethrin. Products like Canine Advantix 2, Frontline Shield, and Vector 3D. Permethrin works great for dogs, but it is extremely toxic to cats.
Extremely toxic.
Okay, that sounds serious.
It really is. If you have cats, you need to be incredibly careful using these products on your dog. Keep the cat completely away from the dog until the product is bone dry. Don't let them groom the dog. Accidental exposure can cause severe neurological problems, even death, in cats.
Wow. Okay, multi-pet households need to be super vigilant with those topicals.
Definitely. Your vet is the best person to advise on the safest options if you have both dogs and cats. Other things to discuss with your vet. Certain breeds like collies, Aussie Shepherds might have a gene mutation, MDR1, that makes them sensitive to some drugs. Your vet will know. And of course, your dog's age, weight, any other health conditions, all that plays into the best choice.
Those are really vital points, especially the cat warning. Thanks. So medication is key. What else can we layer on top of that for defense? Good question. Environmental control helps a lot. Keep your lawn mowed short. Clear away leaf piles and brush where ticks like to hide. Trying to make your yard less inviting to wildlife like deer or rodents that carry ticks. Also, after you've been hiking or walking in grassy or wooded areas, toss your clothes in the wash. Ticks can hitch a ride inside that way. Some people consider professional yard treatments, but always make sure they use pet-safe products if you go that route.
Makes sense. Reduce the habitat.
Well,
What about checking the dog?
Absolutely essential. Daily tick checks, especially after any time spent outdoors. Be methodical. Check their head, neck, shoulders. Feel carefully. Inside and behind the ears, around the eyelids, under the collar. Check under their front legs, between their back legs, definitely between their toes, and around the base of the tail. Feel for any little bumps.
So be thorough. Daily.
Yep. It makes a huge difference in catching them early.
Oh, and one more thing. There is a Lyme vaccine available for dogs. It's not for every dog, and it doesn't cover other tick diseases. But if you live where Lyme is common, it's definitely worth discussing with your vet as an extra layer of protection.
Okay, vaccine is another tool in the toolbox. Great. But let's say despite all this, we do find a tick latched onto our dog. What's the immediate plan? How fast do we need to get it off, and what's the right way to do it?
Okay, deep breath. Finding one is common. The key is prompt and proper removal. That really cuts down the disease risk. Remember, for Lyme, it usually takes 24-48 hours of attachment, but some other diseases can transmit much faster, maybe in just 3 to 6 hours. So sooner is always better. As soon as you find it, get it out.
Okay, sooner is better. What's the technique? All right, step by step. 1. Put on gloves if you can. Protect yourself. And try to keep your dog calm and still. Maybe get someone to help hold them. 2. Part the fur so you can clearly see the tick and where it's attached to the skin. Good lighting helps, maybe a magnifying glass if it's tiny. 3. Use fine-tipped tweezers or a special tick removal tool. Those little hook-like ones work well too. Get the tweezers right down as close to the skin as possible, gripping the tick's head area. Crucially, do not squeeze the tick's body. That can inject nasty stuff into your dog. Never use your fingers.
Don't squeeze the body. Got it. Then what?
4. Pull straight upwards. Use steady, even pressure. Don't twist or jerk. That might break the mouth parts off and leave them in the skin. Just a slow, firm, straight pull. If you're using one of those hook tools, you usually slide it under and do a gentle twist. Follow the tool's instructions.
Okay, straight up, steady pressure. What if the head or mouth parts get stuck?
Yeah, that happens sometimes. Don't panic and don't try to dig them out. That usually causes more irritation. The body will typically expel them naturally over time. Just clean the area well. If you're really worried or if it looks inflamed later, check with your vet.
Okay, don't dig. Let the body handle it. Phew. What next?
6. Once the tick is out, clean the bite area well with soap and water or an antiseptic wipe. 7. Dispose of the tick. Don't just crush it. Put it in a small sealed jar or Ziploc bag with some rubbing alcohol. This kills it, and importantly, you can save it for identification later if your dog does get sick. Your vet might want to see it.
Good tip. Save the tick in alcohol.
8. Wash your hands thoroughly with soap and water, and clean your tweezers or tool too. 9. Keep an eye on the bite site for the next few days or weeks. Watch for any redness, swelling, or rash, and monitor your dog for any of those illness symptoms we talked about. Call the vet if anything seems off.
Perfect. That's a clear plan. Now, just as important, what should we absolutely never do? You mentioned fingers.
Right. Never use your bare fingers to pull a tick off. Also, forget all those old wives' tales. Do not use petroleum jelly, nail polish, a hot match, or any chemicals to try and make the tick back out. They don't work, they're unsafe for your dog, and they can actually stress the tick, making it more likely to regurgitate infectious stuff into the bite. Just stick to the tweezers or tick tool method.
No Vaseline, no matches.
Got it. Okay, so proper removal is key. But what if, despite everything, our dog does start showing symptoms?
Then it's straight back to that key advice. Prompt veterinary attention. Your vet will assess the symptoms, ask about tick exposure, maybe run some blood tests. For most tick-borne bacterial diseases, treatment usually involves a course of antibiotics, often doxycycline, plus supportive care fluids, pain relief, whatever they need to manage the symptoms.
And what about tick paralysis? You said that's different. It is. For tick paralysis, the absolute #1 treatment is finding and removing all the ticks. Once the source of the toxin the feeding tick is gone, the dog usually starts improving pretty quickly, often within hours and usually fully recovered in 1 to 3 days. Your vet will do a thorough search, maybe even shave patches of fur if needed, and might apply a fast-acting tick killer just to be sure none are missed. But supportive care is still vital while they recover. Especially if they're paralyzed, they might need IV fluids, help with turning to prevent sores, bladder management, hand feeding. And monitoring their breathing is critical, as respiratory failure is the big danger. They might need oxygen support in severe cases.
So removing the tick is the cure for the paralysis itself, but they might need intensive care while recovering.
Exactly. The prognosis in North America is generally really good if the tick is found and removed promptly and they get good supportive care.
Okay, that's reassuring. This has all been incredibly helpful, really practical stuff. But let's maybe end our deep dive looking forward a bit. Is there anything new or interesting on the horizon in tick control? Any promising research?
Yeah, actually, there's always ongoing research. One area that's getting some attention is natural alternatives. There was a recent study looking at a specific essential oils mixture. Brand name was Lisheka, I believe. It contained garlic oil, something called allicin, which comes from garlic, and rapeseed oil. They tested it orally in dogs against ticks.
Essential oils, interesting. Garlic oil, how did it perform?
The results were pretty striking, actually. They gave it orally for 3 days. They saw a 75% reduction in live ticks just 6 hours after the first dose. And it hit 100% efficacy, meaning no live ticks by 12 hours after the third dose. And what was really impressive was that it stayed at 100% efficacy for 7, 14, and even 21 days after the treatment stopped. Plus, it showed 100% preventive efficacy, too, meaning it stopped new ticks from successfully infesting the dogs.
Wow, 100% efficacy for 3 weeks from an oral essential oil mix. That sounds almost too good to be true. What about safety? That's always the concern with oils.
That's the crucial question, you're right. And according to this study, the mixture was found to be completely safe. They monitored the dogs closely, general health, blood work, organ function, and found no negative side effects at all, either in the healthy dogs used for prevention testing or the treated dogs. In fact, in the dogs that started out infested, the treatment actually seemed to improve their health. Their blood values returned to normal, and the skin irritation from the bites got better.
That is impressive. Safer and effective. How does it supposedly work?
Well, the thinking is it's a combination of effects. The volatile compounds in garlic and other essential oils can be directly toxic to ticks. They call it a caricidal. They can mess with their nervous system. They might also act as repellents. And some oils can physically damage the tick's outer layer, their cuticle, or block their breathing pores, leading to dehydration or suffocation. Plus, these oils often have antioxidant properties, which might help protect the dog's tissues from inflammation at the bite site. It's also worth noting that garlic and rapeseed oil are generally considered safe as food ingredients by regulatory bodies like the FDA.
Huh. So a potential natural option showing real promise in studies. That's definitely something to keep an eye on. Well, this has been quite the journey, hasn't it? From understanding these tiny, sneaky threats right down to cutting-edge research. It really feels like knowledge and consistent action are our best tools here.
Absolutely. Ticks are definitely a serious and unfortunately growing concern, no doubt about it. But the good news is we do have effective ways to prevent bites, spot problems early, and treat illnesses successfully. And yeah, seeing research into new avenues like those natural products just adds another interesting dimension to how we protect our companions moving forward.
So as you, our listeners, think about your own dogs, your walks, your yards. Maybe reflect not just on the facts we covered today, but on this ongoing interplay. Our environment changes, threats like ticks evolve, science finds new solutions. It all shapes how we keep our pets safe. What's one step you can take this week, maybe starting today, to tighten up your dog's tick protection? And what other questions has this deep dive sparked for you? Keep asking, keep learning. Thanks so much for joining us on the deep dive. Stay curious, stay informed, and keep those pups safe.